Hello, my name is Dave Kent, and I'm the Director of Nursing for an inpatient nursing unit at Desert Regional Hospital Alliance in Boise, Idaho. I am talking to you today about advocacy for our hospital system to initiate a behavioral health training program for all of our nurses and aides. Healthcare organizations such as hospitals, clinics, and nursing homes have traditionally been sanctuaries for the sick and injured. Unfortunately, they have also fallen victim to America's epidemic on violence. In 2014, the Idaho legislature passed an addendum to Title 18, Chapter 915, Assault or Battery upon Certain Personnel, which added battery against healthcare workers. This statute states that any healthcare worker or hospital employee that is struck or injured while performing their duties at their place of employment will be charged with a felony and is subject to imprisonment for up to 3 years. According to the Bureau of Labor Statistics, healthcare workers experience the most non-fatal workplace violence compared to any other profession by a wide margin. With this being said, there is literature to support the increase in violence that nurses are subjected to, and the legislature has amended and incorporated healthcare workers specifically into Idaho statutes to ensure that they are protected at their place of employment. But what are we doing as an organization to help protect our employees? I am suggesting a workforce violence and prevention policy, as well as a comprehensive violence prevention program that would include behavioral health training for all of our employees. Behavioral health training would need to be role specific, and I don't mean hand-to-hand combat or karate training, but outline measures to prevent patient violence, strategies to recognize and respond to violent incidents, as well as how to identify a potentially violent person on admission and treat them accordingly. Generally, newer nurses and aides are naive to hospital violence, as this is something that has not been traditionally taught in nursing school. Staff need to understand how to position themselves in a patient room with a potentially violent person, but also the repercussions of things like wearing their stethoscope around their neck, and then how to alert security to a potentially violent patient or family member. The outcomes of this program, once successfully implemented, could be substantial. Based on our current rate of employee due to workplace violence, we could definitely see a decrease in employee injuries, which according to OSHA guidelines exceeds about $120 billion a year nationally. We would see an increased number of violent incident reports being filled out, as well as an increase in interventions and resource available to reduce escalation and assault. A long-term measure would be to see the nursing retention averages both organizationally as well as high-risk vulnerable areas such as the emergency department and home health. So please join me in the movement to protect our staff and advocate for us to move to a zero tolerance for workplace violence, which would include a behavioral health policy and a program for all of our employees to keep them safe from the people they serve.